Hey everybody, welcome to the month of April. This month we're going to talk about why your back isn't broken, your habits are. Well, we're actually going to talk about a little bit more than that. This is around the time of year, especially in the Midwest, when we start getting outside and we're going to be cycling and running, and then it can start to affect different parts of our body. So this week we're going to talk about hip mobility. We'll give you a couple tools to assess and then what you need to do to follow up.
Hip mobility is a really important factor when we're talking about back pain. If there's any discrepancies side to side, that can lead to imbalances in running mechanics, or even when you're cycling, producing power through your legs. We're going to go over a hip assessment tool that you can use to see if you have any discrepancies in your hip mobility side to side. So this is an easy assessment that you can do to assess the internal and external rotation of your hips. So the first thing that we're going to do is Bridget is going to bend her knees. What she's going to do is she's just going to let her feet fall out to the side, just kind of where they naturally want to fall. So if you're doing this by yourself, you can set up a camera and take a video so that you can look at your discrepancies, or you can also have a running partner help you out with this. So what we're looking for is, are there any deviations side to side? Does she have less mobility on one side than the other? And as you can see here, she has a little bit more internal rotation in her left hip than she does in her right hip. The next one that we're going to do is external rotation. So we're going to reset, and we're just going to have one foot up. From there, you're going to let your foot fall to the opposite side. And what we're looking at here is you want greater than 45 degrees of range of motion. And then also, once we do the other leg, we'll compare and see if there's any discrepancies there. So she was able to go further with her right side into external rotation than she is on her left side. Next, what we're going to do is we're going to talk about a couple corrective exercises that you can do if you do find any discrepancies in your hip mobility.
So our first mobility movement that we're going to do for external rotation is a quadruped hip circle. Now Cassie's making sure that her core is engaged, she's not getting her back in a rounded or in an extension position. So nice and neutral with your spine first to start off. So when she's doing this, she's opening up through this hip socket instead of just yanking her knee around and basically getting nothing out of the movement. So lifting up, out and around, and then back to center. Lifting up, opening up, and really focusing on opening that area. A lot of us get really cramped from sitting all day, so you should be able to feel a nice relief when you're doing this.
So if when you're doing your hip mobility assessment, you found that you were limited in internal rotation, or that's when your feet were falling out, we're going to go over a half kneeling adductor stretch and also an internal rotation stretch to help mobilize through the hip. So you come in an open half kneeling position. So Bridget's left leg is opened up and toed out. From there, what she's going to do is she's going to rock into her left leg. So she's going to get a nice stretch and internal rotation of her right hip, and she should also feel it a little bit on her inner thigh in the left leg as well. So this is a nice dynamic stretch that is great to do before you get on the bike or before you go for a run.